Vitamins and minerals, vitamin E. We will now discuss this next vitamin serving an antioxidant role in various tissues. We see that vitamin E has 8 forms called vitamers. Each of the vitamers contains a chrominol ring with a phenolic functional group with an attached phytyl side chain. There are two classes of these vitamers. One class is called the tocopherols, which are saturated, and the other class is called the tocotrienols, which is unsaturated. Alpha tocopherol is the most commonly found in food products and is the most biologically active. So this will be the form that we'll see most commonly in the functions and mechanisms as it relates to vitamin E. Here we see the structure of vitamin E. We see the tocopherols and the tocotrienols. We see that in each we have this chrominol or chromane ring with the phenolic functional group and the phytyl side chain. We see that in the tocopherols, the side chain is saturated, whereas in the tocotrienols, this phytyl side chain is unsaturated. We'll see here food sources of vitamin E. So vitamin E is primarily going to be found in various oils. This is going to be expressed as milligrams per 100 grams. So wheat germ is actually going to be the richest source of vitamin E, specifically containing this alpha tocopherol. But we see other oils, so safflower oil, we see sunflower oil, we see cottonseed oil, and then other products containing vitamin E, but primarily we see it being contained in oils and within wheat germ as well. We'll now review the digestion and absorption of vitamin E. So we see that the tocopherols are found free in foods, so no digestion is required. However, the tocotrienols will be esterified in food. So the tocotrienols will then need to be hydrolyzed. The different enzymes involved with that process will be either pancreatic esterase or duodenal mucosal esterase. So that will allow for the tocotrienols to then be free and able to undergo the process of absorption. Just like the other fat-soluble vitamins, the tocotrienols and the tocopherols, so these forms of vitamin E, when in the free form, will then be incorporated into micelles with other lipid components and then absorbed by passive diffusion through the brush border membrane. Once in the enterocyte, the vitamin E with other lipid components will form chylomicrons. The chylomicrons will exit the enterocyte and enter lymphatic circulation. After being transported through lymphatic circulation, it will be transported in circulation in the bloodstream to the liver. We see that the liver will recirculate the vitamin E in the VLDL and other lipoproteins for tissue uptake by various cells throughout the body. We see, however, that vitamin E will be primarily stored in adipose tissue. So it won't be stored primarily in the liver like some of the other fat-soluble vitamins. We'll see that will be primarily stored in adipose tissue. So primary role that we will focus on as it relates to vitamin E is its ability to act as an antioxidant. And we're going to see that primarily it's going to be acting to maintain the membrane integrity of cells. It does this by preventing peroxidation of unsaturated fatty acids contained in membrane phospholipids. So we see here that vitamin E is going to be acting specifically on the membrane of cells, so the cell membrane, and we're going to be talking through this process in a little bit more detail. It's going to promote the termination of free radicals, so it's going to reduce free radicals, so it's going to donate a hydrogen, so it will terminate the propagation of the free radicals. The resulting tocopherol, so the tocopherol involved in this free radical termination, that itself will be oxidized, forming a tocopheroferroxyl radical. And so this radical must be reduced, and we're going to talk about how this radical is going to interact with other antioxidants to reduce it back to the non-radical form. So here we see this process of the oxidation of an unsaturated fatty acid, and in the next slide we're going to see the involvement of vitamin E in reducing the lipid radical that was formed. So within our cell membranes, we have these unsaturated fatty acids, which when exposed to, for example, a hydroxy radical, can itself then become oxidized. So we see here the unsaturated fatty acid, and then we see that if exposed and interacting with a hydroxy radical, that the lipid component here will then become oxidized and form a radical itself. So the interaction with the hydroxy radical then forms this lipid C-centered radical. Then we see this lipid C-centered radical can actually have additional interactions with oxygen and form a lipid peroxyl radical. So we see the formation of a lipid peroxyl radical and then further propagation to additional radicals. So the vitamin E will then be involved in terminating this propagation of the free radicals. We can see here this process. So we have here the lipid C-centered radical. Here we have the lipid peroxyl radical, and then we see their interaction with reduced form of vitamin E. And we can see when the vitamin E in the reduced form interacts with these radicals, the radicals themselves then become reduced and they no longer have this free radical oxidative capacity. So they are no longer free radicals and they can no longer have oxidative damage to the cells, especially the cell membrane. However, the vitamin E, you can see as it reduces the lipid radicals itself will become oxidized. So we see that this is the vitamin E radical, which will then itself need to be reduced, and it does this by interacting with other antioxidants. So we're going to see the process here, and we see the conversion of these different antioxidant nutrients or antioxidant enzymes, one becoming oxidized, one becoming reduced. So we left off in the last slide with the alpha tocopherol radical, which was formed when it was donating a hydrogen to a free radical. And you can see for the alpha tocopherol radical itself to become reduced, we see interaction with vitamin C. So this alpha tocopherol radical interacts with ascorbic acid, and the ascorbic acid becomes oxidized to dehydroascorbic acid, and the alpha tocopherol radical becomes reduced back to alpha tocopherol. So after interacting with vitamin C, then the alpha tocopherol then can continue to reduce the free radicals and terminating the free radical propagation. Now we see here we have now the oxidized form of vitamin C, the dehydroascorbic acid, so that itself will need to be reduced. So for that to occur, we see interaction with the reduced form of glutathione. And we've mentioned previously that glutathione is dependent on selenium. So this is a selenium-dependent antioxidant. So we see interaction of the reduced glutathione with the dehydroascorbic acid. So vitamin C then becomes reduced back to ascorbic acid, and glutathione becomes oxidized. So finally, we of course will need to reduce the glutathione. So we need to convert it back to the reduced form, and it does this by interacting with NADPH. So NADPH will donate a hydrogen to the oxidized glutathione, converting it to the reduced glutathione, and the NADPH itself will then become oxidized. So we see this process of the interaction between these three antioxidants, so the alpha tocopherol, we see the vitamin C and the glutathione, and then glutathione then being able to interact with the NADPH to itself become reduced. We will now discuss further implications of the functions and mechanisms of vitamin E. So we see with vitamin E having an antioxidant role, we can discuss and consider potential implications as it relates to heart disease, eye health, and risk of cancer. And so we'll discuss findings from recent research, studies, and conclusions on the significance of the relationship between vitamin E and these conditions. So the ability of vitamin E to inhibit oxidation of LDL cholesterol will suggest a potential implication and interrelationship between vitamin E and cardiovascular disease. So based on its antioxidant capacity, you would think that there may be implications as it relates to heart disease. However, recent large-scale epidemiologic studies currently suggest no benefit or a potential increased risk of morbidity or mortality among those taking 400 international units per day of vitamin E for at least a year. So it's important to keep in mind that these studies that looked at the interrelationship between vitamin E and cardiovascular disease and related morbidity or mortality was looking at an intake well above the RDA. So an intake of 400 international units per day is above the RDA, which we're going to see is 22.5 international units per day. So it looked at the relationship between a higher intake. So as it relates to eye health and vitamin C, some studies suggest that vitamin E intake along with vitamin C and also beta carotene may reduce the risk of age-related macular degeneration. As it relates to cancer, you would think that based on vitamin E's antioxidant capacity that it would support a potential role of vitamin E in reducing the risk of cancer. Though currently recent epidemiologic studies evaluating the relationship between high intake of vitamin E, so a high dietary intake of vitamin E, do not currently support a role in reducing the risk of cancer. So further research is needed in this area. We now will look at the RDA for vitamin E. It's expressed in both milligrams and international units. For adults, it's 15 milligrams per day or 22.5 international units. And we have a tolerable upper intake level of 1,000 milligrams per day or 1,500 international units.